Afternoon and welcome everybody. My name is Tio Quay and I'm Assistant Director Research at UBC Health, currently overseeing the Health After 2020 program. And we're really excited to be here to support today's dialogue session. So first of all, I would just like to start with a land acknowledgement. I'd like to humbly acknowledge that I'm joining you from UBC's Vancouver campus, which is on the traditional, ancestral, and unceded territory of the Musqueam people. The team leading today's session is based at UBC Okanagan, which is located on the territory of the Syilx Okanagan Nation. And I'm also grateful to recognize the contributions of others and that UBC's activities are taking place in community on the traditional territories of numerous First Nations and Métis communities, each with their own unique traditions and history. So for those who aren't familiar, UBC Health works under the Office of the Vice President Health. We recognize the growing need for collaborations that address the complex and interconnected problems facing society. And we facilitate collaborations across disciplines, faculties, and campuses, as well as with health partners and communities. Our work enables us to improve the ways we collectively train people, develop knowledge, and shape policy with the ultimate goal of addressing inequities and improving the systems that foster and support health. And through our initiatives, we aim to support an active community of health research practice and mentorship, bring together scholars, students, and community partners to discuss important topics related to the health and well-being of society and advance interdisciplinary knowledge translation. Our understanding of the determinants and experience of health and well-being continues to evolve, and the COVID pandemic highlighted and accelerated several important challenges in health, giving us an opportunity to think differently about how we define and value health, how we understand the complex systems that produce health, and how we rise to the challenge of supporting health equity across individuals, communities, and society. And so in response to this need, the Health After 2020 program was created to foster interdisciplinary collaboration and build a community of UBC Health scholars. Through research collaborations, cross-campus conversations, and events like today's, the program convenes and informs people at a key inflection point for society. Since its inception, Health After 2020 has supported 23 interdisciplinary teams in advancing their collaborative research and engaging with broader communities. Our commitment is to facilitate collaborations that prioritize community engagement and innovative approaches to putting knowledge into action. The third cohort is supported through a partnership with UBC's Knowledge Exchange Unit that aims to build capacity in these areas. And so we're here today. I'm really proud to be supporting today's session, which will focus on cross-institution collaborations addressing the unregulated drug crisis in British Columbia. Thank you so much to everyone who joined today, and I'll now pass it to the presenters.
Thumbs up. Perfect. Okay. Well, welcome to our dialogue this afternoon. My name is Lauren Airth, and I'm a registered nurse and researcher with UBC's Hind Lab, as well as co-founder and former project coordinator of UBCO's Harm Reduction Team, or HART for short. So excited to share a bit with you about things we learned about drug checker experiences and collaborating across institutions and disciplines today in the context of drug checking. So as a super quick introduction to drug checking for folks who are unfamiliar, there's a number of different technologies that are used in drug checking, some of which you can see on the slide here. But the reason drug checking is important is because we always say the most dangerous drug you can take is the one that you don't know you're taking. So this would be sort of like if you go to pick up your coffee tomorrow morning and someone slipped some Benadryl in there and you didn't realize it was in there. Benadryl can actually be great in treating an allergic reaction, but if you don't realize it's in your coffee at the right concentration, Benadryl can actually kill you as well, or make you sleepy if you're trying to wake up with your coffee. So that's what we're looking at in the unregulated drug supply, because folks don't have access to labels like there is on a beer can or that sort of thing. So drug checking essentially provides people with personalized harm reduction information about what is in their drug sample, as well as access to other harm reduction resources. And this also allows us to monitor drug market trends when we can collect data about what's happening in different areas. So this helps to obviously reduce harm and reduce the number of deaths that are occurring from the unregulated drug market. So the unregulated drug supply, as a quick history, it was declared a public health emergency in 2016, which is when the government supported the implementation of a pilot project for drug checking. And then that led to the implementation of Substance, or UVic's Vancouver Island Drug Checking Project, being launched a couple of years later. And then in 2020, Interior Health contracted UBCO in the Interior to begin offering drug checking services in the community, and UBC then subsidized services to be offered on campus as well. But because of a lack of access to safe supply, by 2023, unregulated drugs have become the leading cause of death for folks in BC between the ages of 10 and 59. So obviously we need interventions to address this crisis. And you can see that when we hit 2020, there was a big spike, which there's a lot of things we could talk about for what went into that, but not the focus for today. Stay on task. But at present, UBCO actually terminated their drug checking contract prematurely as of June this year. And so at the moment, they are not involved directly in the delivery of drug checking services. And UVic is still operating Substance, which has services in the community, but not on campus. So that is sort of where we're at now with things. But I'm going to pass it over to Dr. Wallace briefly to just talk about the provincial landscape.
Thanks, Lauren. In 2023 at Substance at UVic, we decided to take an environmental scan of drug checking in British Columbia because British Columbia is quite unique in how much drug checking we do. And also because drug checking in the province was started through federally funded pilot projects, and it was shifting a couple of years ago towards more of a provincial and regional health authority publicly funded service as part of the overdose response. But because it was more crisis response than planned, we wanted to sort of get a baseline of where things were at in the province. And so then and now, there's drug checking in every health authority in the province, and there's over 40 access points is what we recorded in 2023, where people could access drug checking, and most of those were with infrared spectrometer on site and test strips. And last year, probably over 35,000 samples were checked for people in the province. And then building on that, since the environmental scan, again, with the public health support in the province and in the health authorities, there's been more work towards coordination and having a provincial platform. So Substance has been working with the BC Centre for Substance Use and the province and BC CDC to be able to try to work towards getting complementary testing, working with the Vancouver Island University for mass spectrometer access for all these, as many of these sites as possible in the province through each health authority, and to be able to provide more localized reports with some of those technologies that can offer trace level and quantification of the results. Back over to you, Lauren.
Thank you. Yeah, so a quick intro to how we ended up with this Health After 2020 dialogue. And just to plug a note in as well, I meant to mention this earlier, but if folks have questions throughout the presentation, please feel free to pop them in the chat, and then we'll have a bit of time at the end for questions. So as those come up, feel free to throw them in there.
Excuse me. Hello. Excuse me. Can I just follow up, ask, so how many sample was checked this year, 2024?
Hi, Kenneth. It would be wonderful if you could pop your question in the chat, and then we'll save it to the end just so the speakers have a chance to share all of their
yeah,
work.
I realize that, but it's a timing questions. So I really want to know how many samples was checked, and we have 2,500 people die. So how many samples were checked related to how many people die? Is a correlation there?
Yeah, it's super important to consider how many people we're reaching. And that's sort of part of what we'll talk about today is how we are reaching different groups and what that looks like when we're thinking about equity in terms of who can access these services and who we're still trying to reach. So it's an important consideration for sure, and happy to talk about that more when we can dig into a bit more of these questions at the end. So thank you. In terms of the grant that we used for this work, you can see Piotr and I on the slide there. When we got to get together, we went to a few different sites. So folks from UVic were able to come to UBCO, UBCO went to UVic, and then we also collaborated in festival settings. But the idea for this work sort of came out of when we were collaborating in a festival setting. And it was really Piotr who drove the question of like, hey, what would it look like if people could collaborate more in the drug checking field because we were learning so much from each other in that space. So we wanted to ask more about that, and specifically with this grant, looking at what is the role of universities in drug checking, and how can we better understand those experiences and think about how to collaborate better. So kind of looked at it as a case study almost of drug checker experiences, looking at UVic and UBCO. And the objectives were, like I say, to inform equitable service delivery models, to provide those opportunities for cross-collaboration learning, and to work towards a provincial drug checking strategy. So we'll have the chance now to hear from a few folks about their experiences as drug checkers. And I'm going to hand it over to them at a quick introduction here. We have Jordyn Cates speaking, who is a member of the Okanagan Indian Band and a doctoral student in clinical psych at UBCO. We have Piotr here, who is a master's student at UVic, and Katy, who is a coordinator for substance drug checking out of UVic. So I will pass it over. Each of them will speak for about 10 minutes just about their experiences, and we will start with Jordyn.
Hi, everyone. Thanks, Lauren. So I figured I would chat a bit about my experience working with UBCO and the Heart team. And I thought I would kind of just walk you through kind of developmentally how we got here today. So I started working with Heart in 2021, and I became the community drug checking tech. So that was a position that was funded through Interior Health, and then also in collaboration with UBCO. So it's kind of a couple people that are involved in being able to have our harm reduction team. And I think that's kind of important to highlight because it's not just one person that makes this all happen. It's a community of people. So we, in the beginning, when I started, we were servicing Kelowna, Vernon, and Penticton, in addition to our campus delivery. And we would have on-campus drug checking 1 to 2 days a week. And that was with other student harm reduction workers, which were funded through the university. And as our program went on, we got more funding from the university to be able to have more students on the harm reduction team. And I think something that I kind of wanted to highlight, which is important for us to be able to have this discussion, is that in April of 2022, Lauren and I were driving back from drug checking in Vernon, and I had mentioned that this Indigenous STEM group that I had co-founded was having a tour of a new building at UBCO. It was called the IP1 building, which is where Lukas, Dr. Bichler, is kind of works out of. And so we were just going to kind of get this tour, and when we were there, I noticed that he had a GCMS, which is a kind of a piece of machinery that we could also use in drug checking applications. And I had just kind of asked Bichler point blank if I could put drugs in his machine. And that led to numerous conversations about collaboration between like engineering and nursing, which, I mean, drug checking is very interdisciplinary. So a variety of collaborations. But I think that's just a really important collaboration to kind of note. And then I think the other thing that I wanted to talk about was how in the summer of 2022, like Lauren had said, we started kind of breaking into the festival drug checking setting, which is different than community or campus drug checking, but this really facilitated our ability to learn about drug checking in different settings, but also collaborate with other drug checkers, which is not something that happens super often when you're just trying to kind of keep your program afloat with the limited funding that is offered for these kinds of services. And so we were able to attend a variety of music festivals and then eventually like partner with smaller community organizations to be able to deliver drug checking at music festivals within Kelowna. And I think this really just overarchingly highlights how it's hard to make the distinction between community and campus and festival. Like, even though there is that distinction, students are in the community, students are on campus, and students are at festivals. And so being in all of these spaces allows our team to connect with people in a variety of settings, which allows them to, feel more comfortable accessing this service, because someone might not feel comfortable going to campus drug checking, but might feel comfortable going to community, or vice versa. And I think that's something that we had heard from students too, is making sure that they are comfortable accessing drug checking. And I think without this experience of being in all of these different settings, we might not have been able to learn these lessons to eventually kind of push us into the space that we're in now, where we can, it's unfortunate that the drug checking has been terminated, but we're in a new zeitgeist now where we have these lessons learned and we can carry these forward, which will allow us to continue to advocate for drug checking to be provided on campus, but perhaps less so through just like service delivery, but more so through research lens, which will allow us to really hear from the people who are accessing the service, so that we can create spaces that everyone feels safe to get their drugs checked. So I guess overarchingly, the experience from drug checking with Heart, specifically on campus, is one that, like, there's just so much experience that has come from it. And I think we're in a new kind of era, which is going to be it's very exciting. And I hope that we're able to maintain our like interdisciplinary collaborations, to continue to meet people where they're at and provide them with the most comfortable space for them to access these kinds of services. Thank you.
Yeah, that's great. Thank you, Jordyn. I was wondering too, if you wanted to speak a bit more to, as a student, like you're a doctoral student in psychology, how you feel like your work as a drug checker has sort of, I guess, gone back and forth between like your studies informing your work as a drug checker and your work as a drug checker informing your studies, and even a bit about like how the psychology group has been able to support folks in the community, and yeah, that expansion to address some of the inequities for some of our local First Nations communities. And yeah, just wondering if you could speak to that a bit too.
Absolutely. Yeah. Thank you. So my work in like my research focuses on substance use broadly. And I'm very lucky to have a supervisor who is very supportive of my work outside of my research. And I think the work with Heart, I worked with Heart before I got into grad school. And so it was, it's experience, like, I don't even know how to describe it, but I think the experience in drug checking just really gave me an experience like no other. Just the perspectives and being able to connect with people with such stigmatized kind of conversations. I think it really helped me move into this field in clinical psychology. But I think now I'm in a position where I'm fortunate enough to have experienced all of these learnings and lessons, and meeting all of these different people through drug checking, which now has put me in a position where I've just recently collaborated with Okanagan Indian Band, which is where I'm a member from. And we have just submitted an application for them to be able to have their own FTIR machine, so that they can provide drug checking for their community members and more broadly. And so I think, these were conversations that Lauren and I were having in 2021 when we were sitting, in in different partner organizations providing drug checking, and they were kind of more of a dream at that point. And so now, several years later, those dreams are a reality because of all of the experience that, and like all of the networking and the relationships that we've been able to foster. And I wouldn't be able to, connect with OKIB and offer some expertise in the field for them to be able to get this. Fingers crossed we get the mission, like the grant. But yeah, like they're wanting to collaborate with UBC for how, like, developing research questions, but also eventually to have this like hub, this drug checking hub, whether that be at UBC Okanagan or Vancouver or both, to really tap into the technology that's just, it's not just sitting there, but it's doing other things. But there's definitely like endless opportunity within an academic institution, and all the technology that's there to be applied to other kind of disciplines like drug checking, for example. So yeah, I think my experience with HEART and my experience as a student is, I don't know, it's very much in parallel and very much supports each other. And I really wouldn't have it any other way. And I hope that, there's other universities that can find it within themselves to create policies that allow for drug checking to be something that's there, whether it be in a research capacity or a service capacity, so that students and community members can have the opportunity to engage in these conversations with people who are using drugs, and to create less stigmatized spaces, because everyone deserves to feel comfortable when they're reaching out for help.
Yeah, awesome. Thank you, Jordyn. Yeah, I love the story of how it's kind of turned into like us just checking out some other technology on campus with Dr. Bichler and the ideas that came out of that, and now seeing Jordyn pursue these community collaborations to support the implementation of drug checking for other communities where we know they're facing inequities with harms from the unregulated drug crisis, and just the way it informs education and like the Jordyn's studies and everything. I think it's just such a neat space to be in. So with that, we'll pass it over to you, Piotr, to talk a bit more about being a master's student and working with substance.
Yeah, awesome. Thank you so much, Lauren, and thanks for this opportunity to talk to you folks. Sorry, can you hear me? I'm unmuted, right? Yeah, okay. I'm grateful for this opportunity to talk to you folks about substance and about my experience as a student. I'll probably just give you a quick little overview about what substance does, just so that you have a bit of an understanding of our service and kind of the scale and scope of what we offer. I'll also talk a little bit about the history of substance, and I'm going to do that because I really want to highlight the importance of relationships and engagement with community members and with movements, specifically the movement of people who use drugs, in order to be able to offer effective services, and how that actually interacts with what we're able to do at the University of Victoria as a research project. And then lastly, I'll kind of highlight a bit of a different experience than you folks at UBCO in terms of drug checking on campus, because despite being able to offer drug checking in community and having quite a robust drug checking project across Vancouver Island and supporting provincial drug checking programs, we haven't been able to offer drug checking at UVic for students on campus. And so I'll highlight some of the challenges and barriers that we've experienced in trying to offer drug checking on campus. And so, as Lauren mentioned earlier, substance drug checking began as a collaboration between Bruce Wallace, who's here on this call, from the School of Social Work, and then Dr. Dennis Hoare, who's here from the School of Chemistry and Computer Science, who I believe is also on this project. And so, you've kind of got two seemingly disparate kind of research fields coming together to see whether drug checking can have an impact in the ongoing toxic drug crisis, which, Lauren also mentioned had been declared a public health emergency a couple of years previously. And so initially, we kind of leveraged relationships that we had in the community. So specifically relationships with harm reduction organizations, so AVI Health and Community Services, who are offering overdose prevention services in town, and also specifically with the Drug User Union here on Vancouver Island, and that's solid outreach, and they're kind of like a peer-based drug user advocacy group. And I think it was really important for us to leverage those relationships, because in order for people to feel safe accessing our service, we needed some legitimacy, and we needed that legitimacy through our work that we did with the community. And so initially we were able to offer drug checking through these existing organizations and services. So we were offering drug checking a few times a week at Solid, and offering drug checking a few times a week at AVI Health and Community Services. And over the following years, we really tried to kind of bolster our relationship with service providers in Victoria. Largely, COVID had a big impact on that, because when COVID happened, obviously these organizations shut down, and everything kind of went towards an outreach model. And so drug checking also took an outreach model. We were actually organizing with different housing providers to be able to kind of do a milk run to collect samples and check those drugs. At the time, I was an undergraduate student at UVic, and I thought it was really interesting being an undergraduate student, I was studying political science, and then looking at the politics of drug checking and harm reduction kind of in the midst of multiple public health crises that were existing. But it was really kind of through developing these relationships with service providers that when we got our own storefront in 2021 on Cook Street in Victoria, we were actually able to have a really kind of strong foundation within community for people to access our services. And so we, at Substance last year, we were able to check approximately 10,000 samples in 2023. And this year we expect to check considerably more. We also have a distributed drug checking model, which I think is quite important in terms of the services that we offer. And that's essentially that we provide drug checking through a hub and spokes model to different smaller communities across Vancouver Island. And so smaller communities, harm reduction organizations within them house one of the FTIR spectrometers, which we talked about earlier. And folks can actually offer drug checking within these communities, because we're able to interpret the drug checking or the drug samples through our central hub in Victoria. And so this really speaks to the need of developing with organizations, with people who use drugs, in order for us to be able to offer drug checking in a way that's viable. And so what's really interesting is, despite being able to offer drug checking across Vancouver Island at all of these different sites, despite having arguably a leading kind of research program around drug checking internationally, housed at the University of Victoria and the Canadian Institute on Substance Use Research, we haven't been able to offer drug checking on campus. And so I'm just going to take you through a little bit of the timeline, and just to highlight some considerations and barriers that we faced in order to be able to offer drug checking on campus, kind of in contrast to what you folks experienced at UBCO, where you've had, at least initially, maybe not so much anymore, had access to drug checking on campus, whereas it was that community piece that was a challenge. Whereas at UVic, UVic really loves the community aspect of drug checking. UVic has been extremely supportive of us drug checking within the community space as a response to the ongoing toxic drug crisis. And UVic has come out with a lot of promotional material and communications around the importance of our program. Yet we still have faced challenges in offering drug checking on campus. And so initially, when we started the project and we were looking at potential ways to engage the student body, we went straight to the student union. And we know that, the student union is very active in terms of advocacy. The student union at our university, so the UVSS, as they're called, the UVic Student Society, has a safer drug use campaign. And so certainly kind of ethically and in terms of kind of our values, we aligned for what we wanted to offer on campus, which was a harm reduction program to let people, especially students, access drug checking services. But unfortunately, in our negotiations and in our discussions with the student union building, we came up with the challenge of insurance. And so insurance wasn't willing to essentially adopt the liability for us to offer drug checking on campus. And so we weren't able to offer it at the student union building. And so then we engaged in conversations with the university, specifically the student wellness program, who had been interested in partnering with us to offer drug checking. And one of the kind of fundamental challenges with drug checking, not just at the university, but more broadly, is finding a space that is both private and anonymous enough, but also open and welcoming, which can be quite a contradiction on campus. And so we thought maybe at the Student Wellness Center, but then we realized that folks had doctors there, folks had primary care that they maybe didn't want to interact with their kind of harm reduction motives or the things that they wanted to do drug checking for. And so unfortunately, that also kind of fell through. And despite all of these different groups on campus really wanting to offer to partner with us to do drug checking, we just kind of kept coming up against like administrative and logistic challenges. So, you know, one of them primarily being finding a location on campus that would be willing to host us. And then the second being kind of liability. And so one of the kind of other challenges we came up with was that folks really wanted to include, you know, facilities, wanted to include all of these different folks that would have to be part of the discussion or at the table, which didn't necessarily align with our values. And so, you know, some of the folks who wanted drug checking on campus also wanted to include security and wanted to include Saanich police. And as a drug checking project that is in relation and in solidarity with people who use drugs, we had to kind of look at our own ethics of whether we would be able to offer drug checking in collaboration with security and police, and that didn't align with our ethics. And so we just didn't want to kind of potentially jeopardize our service in the inner city to try and kind of engage in drug checking on campus when we continued kind of meeting all of these administrative barriers and challenges. And then recently, you know, there was a high profile overdose that happened at UVic, and which resulted in kind of this renewed pressure for the university and universities across British Columbia to address harm reduction on campus. And so we do have kind of a renewed interest in offering drug checking on campus. And we'll see whether this kind of, you know, more high profile, more kind of active media presence will allow us to finally get the opportunity to offer our services on our own campus.
Thank you, Piotr. That was a great overview. And yeah, it's a very interesting contrast between UVic and UBCO, and part of why we love working together, and that UVic is very supported in being in the community, not so much on campus, whereas at UBCO, we are very much supported in continuing services on campus, but not in the community due to concerns about liability for the university and us operating in the community, despite those valuable relationships. So there's a lot to learn from each space, and I think it just speaks to those historical perceptions of risk and how subjective those perceptions are, and how we need to challenge those moving forward as we think about what is health now and how are we engaging together. Which leads me to Katy to talk more about sort of where the direction is headed with these things.
Thank you so much. So I'm going to talk a little bit about some cross-institutional collaboration that we're currently doing. So that's via our provincial pilot, and that started in September 2023. And it is a collaboration with Dr. Chris Gill at VIU through chemistry, and then as well the BC CSU for access to BC, which is their database that collects all of the information for all of the drug checking that they do in multiple different areas. So the database contains things like sample descriptions, FTIR, spectra, and strip results. And so samples are sent to us via Purolator from 5 different health authorities, and including 13 different unique sites within BC. And about 160 samples are run per week. some of the things that are really great about this pilot is we've had opportunities to connect with multiple different drug checkers and create a little bit of like a community of practice where previous to some of this work, there wasn't the same connections like amongst the province. And so drug checking could be like quite an isolated event that was happening in various different places. We know that there's regional differences. We know that there's like multiple different factors that are coming in, but there wasn't necessarily a way to share some of that information. And so we get to do this provincial work that I'll talk a little bit more about, but also like not forgetting the collaboration and the ability for folks to connect on something that there's a lot, like it is a political thing that we're doing. And so there's a lot of like unknowns and uncertainties, and there's a lot of change that happens over time. So some of the benefits that this project or this pilot has done has allowed confirmatory testing for multiple different regions. So with paper spray mass spectrometry, we're able to see like more trace components, we're able to quantify, and we're able to mitigate some of the limitations that FTIR or point of care testing has. So it's particularly helpful for samples that are difficult to like fully interpret on FTIR. Things like multi-component samples, if there's multiple fentanyls, if there's multiple benzodiazepines, or if they're existing under that 5% kind of threshold that FTIR struggles with, it allows us to be able to provide a little bit more information to community. It allows us to contribute to some provincial reporting and identify regional clusters and trends and things that are happening, sometimes amongst many places, sometimes in like very particular regions. The provincial pilot also demonstrates the feasibility of paper spray mass spectrometry across the province. We happen to have the site that is able to do that, but it doesn't mean that it wouldn't be potential in like multiple other areas. And it also enhances the capacity of partners to interpret their own point of care samples. So when you have some of the limitations of FTIR, but then you are able to see confirmatory results from paper spray mass spectrometry, then it can help inform interpretation of FTIR results in the future. One of the things that was really great, or that has been really great about this, is with the collaboration with multiple post-secondary institutions, we're able to test workflows and enhance confirmatory testing in one site and kind of iron out some of the challenges and see where some of the kind of limitations of technology can be and where some of the growth areas can be by actually doing like a lot of sample checking. And I think I mentioned at the beginning the community of practice, but I think that that is one thing that with folks connecting regularly through meetings and through a provincial newsletter, and then also symposiums have been developed from some of this work where there's been the ability for folks to get together in person to connect and to commiserate and to discuss a lot of the challenges, but also the benefits of what we're able to do together as a group. And I think another thing is that it has really allowed multiple institutions to have like interdisciplinary work together. So between like computer science, between chemistry, between social work and various other community partners, and including folks with lived experience, it's really provided like a multiple like lens factor on like a common issue that we're all trying to tackle together. It has definitely had some barriers and some challenges, that's for sure. So mass spectrometry or paper spray mass spectrometry has great value, but it also has a lot of requirements. And so it requires instrumentation, it requires a lot of collaboration between like multiple labs trying to figure out how to navigate some of the challenges. The instrument itself can be really sensitive to heat, dust, various different things. And we run a community lab basically. So in our site, we have the mass spectrometer right there, but we also have a door opening on a regular basis. And we have a lot of different things that are kind of unexpected that you may not think about when you're primarily working within a lab environment. So it showed us how we could bring a lab to community, but also some of the challenges that come with that. The samples for the pilot, so what will happen is that they would be analyzed via FTIR at a site, and then they would be uploaded to DCBC. with the spectra and a strip result. And then, so the person would get their results for FTIR, but then the folks at the sites, in the provincial sites, will send us a sample via Purelator, and then we will check that there. So the results are not immediate. So the person who's come in to get their sample checked will get a result, but they're not going to get the confirmatory result right away. There isn't a huge delay, but that is something to consider, that sometimes folks want their complete results right away. If somebody comes into our site at Substance, they're able to get multi-instrument results, whereas that's not something that's available throughout the province at like the immediate point of care quite yet. And they also, like many samples, like because all of the samples are coming from DCBC, we as an institution at UVic don't have access to edit or modify any of those entries. And so there can be challenges with working in between the institutions, because without having capacity to edit or to flag or to like change any of the results, not the results, but the entries within that, it means that, for example, if a sample isn't flagged, we don't ever get to see it because we don't have access to see it, but yet we'll have the sample show up at our site. And so then there's a lot of collaboration that needs to happen between drug checkers at multiple different sites to make sure that we have all of the information that we need to be able to provide the response. And then I think one of the big things is that prohibition is probably our biggest barrier, is that there have been immense amounts of challenges on how do we figure, like how do we navigate where samples can be tested, how can they be sent, because there is so many, like policies and many different like prohibitions for us to be able to do our work, which then feeds into like the stigma. And also it's not an apolitical thing. And so there's hesitation on multiple different levels of how involved do we want to get, et cetera, et cetera. So it's a really great project, and it's a really wonderful example of how multiple institutions can work together. But it has definitely highlighted some of the challenges and allowed us to be able to see how this project could be implemented on a larger scale, but not without a lot of resources and considerations that we found throughout the year and a half that we've been doing it.
Yeah, thank you, Katie. It's awesome to hear more about how those collaborations are working and just the potential with the amount of technology even that Katie referenced and all the different databases that are involved and the different folks who need access. There are so many different opportunities for people from various disciplines within different institutions to become involved, and we need that collaboration to be able to expand the field, like Katie was saying. Just going to open up these slides again here. So we were able to visit the different sites that we've chatted about today as part of this grant. And then we also conducted surveys with a small group of drug checkers around the province from UVic, from UBCO, as well as festival settings, to get a better idea of what their experiences have looked like. In terms of the data that we collected related to these experiences, most folks were between 25 and 34 years of age. They were mostly men who were straight and white, and who earned between $40,000 and $59,000 a year. So that's sort of the data that we're looking at here. And we use the REAIM implementation science framework to collect some of this data. So basically just looking at different domains of what their experiences were like. But when it comes to the reach of drug checking experiences and who drug checkers feel like the service is reaching, they feel like we're consistently seeing an increase in sample volume with more and more samples coming in different settings. But there's a lot of interest in trying to engage more diverse groups in more diverse settings and being able to collaborate with other folks. In terms of effectiveness, drug checkers feel like the service is really effective in monitoring the drug supply, and they feel like it's effective based on the feedback that's provided from service users who talk about how it's prevented them from experiencing a drug poisoning, and partners in the community who really value the service as well. And then for drug checkers who take up the service, or the different settings that take up the service, a lot of drug checkers just simply really enjoy their job. They love what they do. They love being in the space and being what they call drug nerds often, is how we label ourselves. So really just enjoying it and caring for the community and being able to prevent harm. But one barrier for a lot of folks is that there needs to be some improved compensation and more standardization around job roles to better support that infrastructure. And in terms of implementation, as you've heard today, there's so much collaboration involved in being able to implement these services. But along the lines of the job role piece, there needs to be enhanced recruitment and training to be able to continue to bring the people that we need into these spaces and to make sure that they're being trained appropriately. And in terms of maintenance, the integration of these services into systems, as you heard today as well, is really challenged by the fluctuating politics and policies and funding. So we need more policy support behind these services in institutions like universities, as well as in different community settings. And we need more enhanced infrastructure to better support the development of these technologies, those cross-campus and cross-discipline collaborations. In terms of what's next from what we've learned with this study, we're using data to continue to advocate for drug checking services to be re-implemented on campus at UBCO, and working with the Hein Lab as well to see the technologies that they've developed at UBC Vancouver to be better implemented into drug checking spaces on the coast, as well as collaborating with services, as Katy mentioned, in a way where we can better support confirmatory testing throughout the province. And as Piotr mentioned, the province did announce these guidelines for post-secondary institutions to better support overdose prevention work in post-secondary settings. And there's a long way to go, but there's a lot of advocacy happening now at UVic as well to see what can happen on campus, because students are very interested in these services. And we've seen at UBCO as well, there is a huge benefit for students receiving services from other students. So we know already from a lot of the harm reduction and health promotion literature that people really value being able to receive healthcare services from people who understand their experiences. And that's something important to see implemented on campuses for students who use drugs, which there are many of. And I feel like that's important to say because it's not often addressed. And it is a big myth that students don't use drugs, and they do. They use a variety of them. As Jordyn mentioned at the beginning, this project was really inspired by a collaboration with Dr. Bichler, who you can see here, and who I will let speak just for a few minutes here about Dr. Bichler's work with the Clean Tech Hub and the potential for collaboration. So I'll hand it over to you, Dr. Bichler.
Thank you very much, Lauren, and good afternoon, everyone. So my name is Lukas, and I'm a professor in the School of Engineering, and I'm quite far from drug checking originally, but as Jordyn mentioned, Jordyn and Lauren came for a tour of our facility, which is called the UBCO Clean Tech Hub. This hub, or this facility, was actually set up back in 2021 when our previous VPRI of the Okanagan campus had a vision of establishing so-called innovation precinct on our campus. And so between the main campus and the Kelowna airport, we have a relatively new facility now where new infrastructure and new research agenda is being framed. Our research that we do in the Clean Tech Hub as a part of Faculty of Applied Science and the School of Engineering, it does mainly revolve around development of new materials and new technologies for manufacturing, agriculture, recycling, water management, and the local industry. And so clearly there was a great vision to engage with our community partners, but maybe more so on the technology and economy development aspect. That being said, the instrumentation that we have developed and established, it was funded by provincial grants as well as private industry and federal grants. And as Lauren mentioned, we have an FDIR instrument, XRD, so X-ray diffraction, Raman spectroscopy, chemical analysis through various means. We have various microscopes that can be used to study the material itself visually and chemically, and also the thermal behavior of materials, let's say using GCMS and thermal analyzers. And so you heard a moment ago that having access to infrastructure is really key. And for me, who has been working in this environment for a few years now, I thought, well, it absolutely makes sense to open up the doors to as many community partners and as many interested students and researchers. And so when we had the opportunity to apply for the grant, it was a definite yes. From our side, I would say that there are definitely important take-home, learned experiences. We learned that For example, the development of standards and sharing of standards and shared protocols is key. Otherwise, we might be reinventing the wheel that somebody already invented. Um, in my particular case, for example, I have worked with nuclear materials in the past and radioactive materials, and I will confess that sometimes working with drugs can be sometimes more complicated in terms of access, paperwork, security, and safety. So it is not that straightforward. And at the on our campus, we do have protocols that need to be followed. And as I mentioned, knowledge sharing. And so this grant definitely brought an opportunity for our group at UBCO to connect with colleagues at UVic who have had prior experience in the chemistry department. We heard Dennis about Dennis and his work, and so again, it's a great opportunity to continue this work. I would maybe just highlight if there's something really impactful that came out of this experience. I do teach an undergraduate class for 400 students in engineering, and in the past, this was purely just a materials related class. But now I actually take the drug checking reports that Lauren sends out during the regular updates, and I actually share these with undergraduate students. And as Lauren said, I think that a lot of students know that drugs exist and they may be users. But when I present the information from the perspective of what are the chemicals, what are the compounds that are present in these drugs, many students pause. And you can see this, just how impactful it can be to really bring the information that previously, before this grant or before this collaboration, lived in other departments. But now we are bringing this knowledge much closer to all students, and I think that that's really important. I also do want to share that for me personally, this collaboration and working with social workers, healthcare professionals, and psychology students, and so on. For example, we went to the Kelowna safe injection site, and that was a very profound and very powerful experience. And when I convey this experience again to our students, you really can see the interest in the community. I have many students asking me to be co-op students, to be work study students, to participate in this research. And so definitely the opportunity and the interest in engaging in this type of impactful work is really high. Lauren, I'll stop here. I think I was given 2 minutes and I probably went more than that, so I'll stop here. Thank you.
No, thank you. Thank you, Dr. Bichler. The things you shared, I think, are so important for us to think about when we ask that question of do universities belong in drug checking? And I think you really answered that very well. And there's so many different disciplines that can be involved with this work, and we have so much to offer. And I love what this collaboration has brought out. So I really enjoy hearing about it. Thank you. We can open it up for questions now. So I think I just have to navigate my way back to the chat. So I'm going to stop sharing just to make this easier. I don't think I see any questions in there unless any have gone privately. So I see. Great. Tio, did you want to ask something?
Yeah, why don't I get us started? So you mentioned such an interesting mix of interdisciplinary collaborators, computer science, chemistry, social work, other community partners. When you all came together in this community of practice, what was the most surprising learning or, insight that you got out of this, given all the diverse perspectives that maybe you didn't come in with?
Yeah, that's a great question. And I think for myself, one of the big things was collaborating in a festival environment just allowed us to really, in the moment, immediately be trading knowledge and skills between each other to be like, oh, I didn't know that you thought about it this way, or I didn't know that you handled it this way. And just that immediate exchange was so valuable, which is where we really wanted to think about festival environments are somewhere where nobody traditionally looks at and being like, oh, what a rich learning research environment, right? But the things that we did learn in those spaces, I think working with so many different people was just yeah, it's hard to zero in on just one thing, but I think just even, yeah, the practical skills that we traded with each other in drug checking were huge. I don't know if anyone else wants to speak to that from Bruce.
Yeah, maybe I'll just answer from UVic for where I'm with social work and public health and collaborating with Dennis in in the sciences and in chemistry and computer science. I think universities often use the word multidisciplinary research and support multidisciplinary research teams without, I think, without a lot of knowledge or experience about how challenging it is, and also how beneficial, obviously. And so I feel like the collaboration that we have at UVic between science and social work has been very beneficial, but there's so many challenges in doing multidisciplinary work, from how we keep our silos really safe for both teaching and research and dollars and spending and grants, streams between NSERC, CIHR, and SHRC. But also just in some of the equivalencies. So social work students are not paid to do practicums where science students expect a co-op wage maybe. And just I think one of the real interesting parts is that none of us know the whole project. And I really never understood that in a multidisciplinary project. I don't know spectrometry at all, and I'm coordinating it. And Dennis didn't know anything about how to maybe do harm reduction and work with people who use drugs in community, and he has to do that. And so we're constantly dependent on each other in a way that is really a challenging form of leadership when, our project now is in its about eighth or ninth year, to be able to keep that in a sustaining role. So those are some of the lessons that I have on sort of like the benefits of the multidisciplinary, but just I feel sometimes it's thrown out in university land as just like a good thing without some of the complexities that I'm learning about.
Yeah, and Lucas, did you have something you wanted to add there?
I just had a very quick remark that, for example, for me, one of the big learning experiences was that, for example, for Lauren's team, access to the infrastructure on our campus was really key. And from our side, the equipment is there, or it was there, but we never really advertised it that it was available to the community. And so I think in that respect, we have actually become much more proactive and reaching out to the community to say, look, the infrastructure is here. Let's collaborate. And it did, in fact, open up quite a few new collaborations. And the motivation for this was this particular grant and this particular collaboration.
Yeah, I think that's exciting to hear what's come out of it. And I think, yeah, really important comments from Bruce there as well, and thinking about how do we work together. I'm just going to share a link in the chat here, jumping back to the question that was asked right at the beginning about the number of samples. So if you follow this link, it will take you to the BC Centre on Substance Uses, their database, basically their public database that you can look at to see the different samples being checked throughout the province, and you can play around with the data to check different sites and different types of drugs and that sort of thing. But it has a lot of really interesting information there. And in terms of the question that was asked at the beginning, to quickly sort of go back to that, I think it's important to think about the funding that is available for these programs, because that's often dictating what is available and how often to how many people and where, which is where these sorts of collaborations are so necessary to work within that limited funding that we have access to. And we also have to think about who is operating these services and how are they being advertised when we consider who is accessing them as well. There is research to show that when services are whitewashed and advertising is whitewashed, then we're not reaching everyone, and we need to think about how are we engaging in diversity in this space as well, which is something that throw that challenge out to the drug checking community. But I know there's another question here that I'd like to get to, just being mindful of time quickly. So if you want to ask your question here, you can go ahead and unmute.
Hi, I'm Banu. I'm a postdoctoral researcher at School of Population and Public Health at UBC. So first of all, I have been in an addiction medicine center team previously. So I would firstly like to appreciate your work to the community, because I know it's a really challenging task you have been doing. So first of all, so really appreciate that. So I have a few questions, so I'll go through them quickly. The first thing is, I just want to know what type of harmful content have you seen during your services? I know in the States, it's usually fentanyl and xylazine, is it the same in the UBC and the BC area? Or there are different components that you have been seeing mainly in your drug checking?
Right. Sorry. Bit challenging to hear at a certain point there, kind of, but I think you're asking about the drug supply and what we're often seeing in the samples. Yeah.
Yeah.
Yeah. So like xylazine has come up here a bit, but I think it depends often too on where you're checking drugs, and what people are looking for there, because oftentimes if we're in like a community supervised injection site, we have a lot of folks who use down. So their drug of choice then, and down, it's a combination of like fentanyl, caffeine, and sugar. And in that case, then people want fentanyl in that drug, right? But they're looking at, okay, what is the concentration of the fentanyl in that drug compared to the regional average to make sure that they're not going to get something stronger than what they can tolerate. There are other settings, right? If we're checking at a rave, we're seeing a lot of cocaine and a lot of MDMA. So it just kind of varies in a lot of like depending on the setting that you're in and depending on what folks would like. I don't know if anyone else wants to speak to the drug supply question. I know the links that were popped in the chat as well. David also put a really good link to a report there that can help you see exactly what is in the drug supply. But yeah, did anyone else want to speak to that one?
Okay, thank you. So I can go to the other question. So the other one is, are you planning on extending your project to distribute like naloxone for overdose prevention, and also using providing clean needles and cookers to avoid spread of communicable diseases? Is that something you are planning on including in your services in future?
Yeah, great question. So we most drug checking services are located within or adjacent to other harm reduction services. And so typically when someone comes in to get their drugs checked, it's a great time to say like, hey, have you been trained in how to use naloxone? If you want to wait a few minutes while we check your drugs, someone can also show you how to use naloxone. We have naloxone kits on hand, as well as access to sterile supplies. And generally, depending on, again, the environment that we're in for drug checking, there's usually other folks around who have lived expertise in drug use who can talk to that person about how to use that drug in a way that will reduce their risk of harm in the best way possible. So we do try to marry our services with all of those other pieces because we recognize harm reduction is a spectrum, and we can't just come in and plug in analysis data for drugs without talking about the big picture. So most of our services do also include all of those other pieces, which, yeah, is super important. So
the last question. So are you currently sharing any information on the available support services, or are you planning on doing so? Like if someone is struggling with addiction and they want to have information on supports available, do they have access to that during your service, or is that something you're looking to include in future?
yeah, typically when someone comes to access services, the folks who are providing services are able to point them in the right direction of whatever they're looking for. So whether that's if they're looking for a shelter for the night, or if they're looking for a psychedelic drug user group, or if they're looking for addiction services, we try to sort of have that information on hand. And it's the great thing too about working in such a multidisciplinary environment. Oftentimes, a lot of folks like will look to our social workers or our nurses to bring in sort of those wraparound supports. And so one of the things with drug checking as a harm reduction intervention is that we, when people come in, we don't immediately suggest that they stop using drugs. That's not our purpose there in meeting them. But if that's something that they're interested in, then we happily connect them to those resources. And so same with, if they're looking for where's the food bank, or where can I join like an AA group, or, we just try to have a list of all the different potential resources on hand to connect them. And there are some drug checking sites that operate within, like I was saying, a supervised consumption site where they're actually really integrated with like doctors and nurses who are there, who are able to prescribe methadone or something like that pretty quick if someone's interested in that sort of thing. So there's a lot of different service delivery models. But yeah, typically people have those sort of resources to be able to refer someone to or provide them with the information related to just on hand.
Great. Thank you very much, and keep up the good work. Thank you.
Thank you for your questions.
There's no other questions. We're a little bit over the hour, so I think we'll move to wrap up. Any final thoughts from any of the speakers before we do so? No? Great. Well, thank you so much for joining today. We will be sharing the recording as well as some of the other inputs related to this project. And if you're interested in staying in touch with UBC Health or seeing what events we have coming up, there's some links on the screen and in the chat for you as well. We'd also really appreciate, and I know the speakers would probably appreciate any feedback that you have. So you can either follow the link in the chat or scan the QR code, and we will be reaching out to everybody who joined today or registered to give you an opportunity to share your thoughts. So thanks again for joining. Have a wonderful rest of your day, and we'll see you all soon.